I'm Dr. Shane. How are you? Good afternoon. I am the pediatrician and program director for the Healthy Living program here at Community Health Alliance.
Great. So I was going to have Dr. Shane on today to talk about childhood obesity and the work that he does here at Community Health Alliance for Obesity Care Week. So first, Dr. Shane, if you could just give everyone a quick overview of childhood obesity and how you've seen it basically grow over your career.
Well, childhood obesity, when I started with my career, over 30 years ago, wasn't really even something that was thought about because it was so infrequent. And over the course of that time, the prevalence of childhood obesity has almost tripled in numbers. And now we do recognize it as a actual disease process, and it's actually the most common chronic disease for everyone, children and adults together. Obesity is a chronic disease where the body fat, when body fat content gets to the point that it actually starts to adversely affect organ systems and body systems. And we usually use something called body mass index to help determine when someone has excessive weight, and use that as a kind of a gross way to determine body fat content. And what we do with children is we compare their weight with their height in relation to other children the same age and gender as that child. And when that gets to be 95% or greater than that child's peers, we consider that obesity.
And so what you've seen is a growth in childhood obesity, but then also from what it sounds like is you've also seen a correlation to children now having chronic diseases that were not even thought about prior.
Yes. Yeah, so we see kids with prediabetes, type 2 diabetes, fatty liver disease, high cholesterol, high blood pressure, obstructive sleep apnea, a whole host of disorders that obesity can cause.
And so how do you manage and treat childhood obesity with your patients?
Well, the foundation for obesity treatment for anyone is lifestyle change. So that is changing one's options or choices in regard to the foods that they eat, how much they eat, when they eat. It includes sleep habits, physical activity habits, mindfulness, addressing stress and mental health. Obesity is a very complicated and multifactorial process. It's not a choice. It's more than what, for years we thought was just a willpower issue. It's more than just, eating too much and not exercising enough. It's really a biological process that is by and large out of the control of a lot of people. And a lot of it has to do with genetics, which obviously is out of our control. So what we do is we work on, changing things that we can control. And here at CHA with our Healthy Living program, we have a team where we provide a lot of support, a lot of education, which is what was required to make such, big changes in one's life. To hopefully stabilize someone's weight and maybe with time achieve healthier weight. Other things that we consider are medications. Medications can help with our energy regulation system that's housed in our brain, almost like a thermostat for temperature in our house. And in some centers, in some specialty centers, surgery is an option, particularly for adults and older adolescents. But here we primarily focus on lifestyle change. with a lot of support, a lot of education, and then consider some medications as an adjunct or to assist people with making those changes.
Wonderful. Thank you so much, Dr. Shane. I think that this was a great overview of childhood obesity and all the work that you're doing to treat and manage our patients that have obesity. So thank you so much.
Yeah, you're welcome. My pleasure.